There was an announcement today by the Food and Drug Administration. Bettina Gregory has the story.
Today, the Food and Drug Administration approved what it calls the first significant drug to stop women from going into labor too soon. It's called ridodrine hydrochloride, but it's known generically as ridodrine.
A warning today to pregnant women about the possible dangers in coffee, tea, and colas. The Food and Drug Administration says the caffeine in those drinks has caused birth defects in laboratory animals, and that until human testing is more conclusive, expectant mothers should try to avoid beverages with caffeine.
Another health-related matter, the FDA today took its first step in putting into action the Infant Formula Act of 1980.
The Food and Drug Administration today, often in the news and back around the turn of the century, unsafe foods and drugs were also in the news, and that's how FDA came to be. I'm Paul Berry with the FDA Story, a chronicle of science and law working together to protect the food and drug supply of the American consumer. The range of FDA activities today, the scale and complexity of its responsibilities, contrasts sharply with FDA's meager beginning at the turn of the century. Resources were limited, staff few in number, authority almost non-existent. But the Food and Drug Administration back then had an invaluable asset, a truly remarkable man who helped shape its destiny, Dr. Harvey Washington Wiley.
I met Dr. Wiley at an AOAC meeting in 1928. It was quite a thrill to me as a young chemist to have seen and heard Dr. Wiley, the father of the Food and Drugs Act of 1906. Dr. Wiley came to the Bureau of Chemistry from Purdue University, where he had been professor of chemistry. He also had served the state of Indiana as a chemist during that same period in their agricultural department. He was a native of the state of Indiana, I believe, and had some farm experience, and certainly was interested in agriculture, and at the Bureau of Chemistry engaged in research projects involving agriculture. He was a physician. He had a medical degree. I do not know whether he had practiced medicine. Most of his work had been in chemistry at the university and in the state, and of course later in the federal government.
In the 20 years that Dr. Wiley and his supporters fought for federal regulation of foods and drugs, they exposed conditions that, in some respects, were so horrendous they seem almost unbelievable today. Foods were commonly mixed with harmful fillers and preservatives. The lack of sanitation caused milk to become a common carrier of communicable diseases. Medications containing narcotics were sold freely, addicting the unwary and causing numerous deaths. Quackery flourished. Worthless medications were sold on the promise they'd cure virtually every disease. Dr. Wiley called for legislation that would curb these harmful practices, and he urged influential groups to join in his campaign. Strong support came from food industry leaders who were facing both dishonest competition and intolerable variations in state laws. In 1903, Dr. Wiley captured the attention of the nation when he established a volunteer squad of young men who agreed to eat food treated with suspect chemical preservatives.
Wiley decided to set up what he called a hygienic table in the basement of the Bureau of Chemistry building, and to select a group of young men, 12 he chose, mostly from the workers in the Department of Agriculture and his Bureau of Chemistry, some from outside, and have them eat food only at that table. Wiley himself, I might say, ate most of his meals with these young men. Wiley studied their health as they went through a diet that had added to it one of these preservatives. But newspaper reporters learned about it, and it was a Washington Post reporter who coined the phrase poison squad and gave rather too much sensational publicity, as Wiley thought, to the whole affair.
Crusading journalists joined in the campaign, helping to arouse public ire by publishing cartoons, articles, and editorials. Public opinion reached fever pitch when a chapter in Upton Sinclair's novel, The Jungle, exposed the terrible conditions in the Chicago stockyards. The crescendo of public concern prompted Congress to pass both a meat inspection law and the Food and Drugs Act. Both bills were signed into law by President Theodore Roosevelt on the last day of June, 1906. The Food and Drug Act prohibited interstate commerce in adulterated and misbranded foods and drugs. Products that violated the law could be seized and destroyed. Dr. Wiley resigned in 1912. His successor was Dr. Carl Ellsberg. Continuing under Ellsberg as chief inspector and succeeding him was a man who would influence the agency's history for 4 decades, Walter G. Campbell. In the early 1930s, Campbell pressed for revisions in the 1906 law to correct some serious shortcomings. Campbell showed Congress a series of posters depicting hazardous products that were sold freely under the existing law. There were pictures of a woman whose eyeballs had been corroded by an aniline eyelash dye, a man who died from a radium water product, quack devices, risky reducing products, and a stack of death notices testifying to the failure of a horse liniment sold to people as a cure for tuberculosis. The posters were put together with products and devices in a dramatic exhibit that became known as the American Chamber of Horrors. But it took a nationwide tragedy to change the law. The crisis emerged in the form of a product that started out as a boom for many people. It was called sulfanilamide, and its infection-fighting properties made headlines when sulfanilamide pills saved the life of FDR's son. But later, a small pharmaceutical firm rushed a liquid form of the drug to the market without testing it for safety. The liquid form contained the solvent diethylene glycol, which is now used in brake fluid and antifreeze. Disaster struck. Headlines the country over broke the news of a mounting death toll caused by the solvent in elixir sulfanilamide. The tragedies pointed to the need for a new law ensuring the safety of drugs before marketing. In 1938, Congress passed the Federal Food, Drug, and Cosmetic Act. President Roosevelt signed the new law on June 25, 1938.
I came to the agency in 1939, just about the time the 1938 Act was taking effect. What it did was make improvements in all areas, drugs, foods, cosmetics, devices, and so forth. New drugs were required to be proven safe before they could be marketed. Avoidable and unnecessary poisons were banned from food, and those that were unavoidable or necessary in production were required to be controlled under safe tolerances. Food sanitation, food and drug labeling were improved extensively. Economic concerns were addressed through standards of identity, quality, and fill of container for foods. Cosmetics and medical devices were brought under control for the first time, and enforcement was improved by authority for factory inspection, by grant of jurisdiction for court injunctions, by increased criminal penalties, and extension of the seizure authority. All of this made for a much better public law.
Pearl Harbor catapulted our nation into World War II. The FDA staff that was stretched thin before the war had to take on a massive drug testing job, created by the new law. Enforcement of the law went on and some important victories were tallied. An anti-obesity product called Marmola, which consisted of ground-up animal thyroid glands, was finally taken off the market after 30 years of litigation. Quack diabetes remedies were removed from the market, their promoters fined and jailed after vigorous prosecution. War was also waged by FDA with varying degrees of success against quack cancer cures and clinics that delivered nothing except transient hope. The discovery and widespread use of penicillin on the battlefields of World War II brought more new legislation requiring certification of the safety and efficacy of every batch. Later, Congress extended this requirement to all antibiotics. New responsibilities were legislated to FDA after the war as food technology made great advances with the use of chemicals. In 1954, FDA was given authority to enforce tolerance levels for pesticide residues of possible harmful substances remaining in food after harvesting. In 1958, the agency was given authority to require manufacturers to prove the safety of food additives. In late 1959, Senator Kefauver of Tennessee began investigating drug pricing. In testimony, it became clear that other problems needed consideration as well. For one thing, there were inadequate controls over the distribution and use of drugs for testing. Legislation was drafted to correct these flaws, but it might never have been enacted had it not been for another disaster.
The application for thalidomide was submitted to FDA in September 1960. I was a medical officer assigned to review it, and it was also reviewed by a pharmacologist and a chemist. We felt the data was insufficient to support safety and requested further information. While this was being assembled, we learned that peripheral neuritis was associated with the prolonged use of the drug in countries where it had been approved for marketing. We asked for further data both regarding this and possible safety in pregnancy. We asked this because at that time there was a developing interest and awareness that the fetus and embryo and the newborn did not always respond to drugs as did the adult.
The answer came swiftly and conclusively. Headlines all over the world reported thousands of cases in Western Europe of malformed babies born to women who had taken the drug thalidomide. The drug company withdrew its new drug application from FDA, but the thalidomide disaster, though avoided in this country, stirred strong public reaction and moved Congress to act. The 1962 amendments to the Food, Drug, and Cosmetic Act added the requirement that drugs had to be effective before they could be approved, and also added other requirements to strengthen the drug law. The amendment added a new realm of responsibility for the agency. During the decade of the 70s, there was tremendous growth in the agency. It no longer regulated just foods, drugs, cosmetics, and devices. In 1971, the agency was assigned the responsibility for setting and regulating safety standards for products and equipment that emit radiation. In 1972, the Division of Biologics was transferred to FDA from the National Institutes of Health. The authority for assuring the safety, effectiveness, purity, and proper labeling of biologics such as serums and vaccines, and for overseeing blood bank operations. With the advances of healthcare technology that employed medical devices, such as heart pacemakers and artificial limbs, new medical device legislation became necessary. It was provided in 1976 when Congress gave FDA the authority to regulate medical devices and ensure their safety and effectiveness. As a result, life-supporting and implanted devices must be tested before they can be sold. The responsibilities Congress placed on FDA in the 70s brought FDA staff to 7,500 employees. Even with the dramatic growth in staff and budget, enforcement of the increasing statutory responsibilities has been an awesome task. In the food area alone, there are 79,000 establishments under FDA's jurisdiction. Investigators inspect an average of 30,000 establishments annually.
We have 47 investigators in the Baltimore district, and there are 6,000 establishments under our jurisdiction.
FDA scientists analyze approximately 27,000 domestic and 17,000 foreign products each year.
Here in the Baltimore District Laboratory, we have 28 scientists who analyze product samples, develop methods of analysis, and do research.
The routine work is taxing enough, but when an emergency develops, sheer dedication gets the job done. When the nuclear incident at 3 Mile Island occurred, FDA people worked around the clock, advising local officials, collecting and analyzing samples of food for possible radiation contamination, and providing pharmaceutical antidotes. When dangerous substances such as PCBs get into the food supply, the lights burn all night at FDA. A PCB spill from one electric transformer sent FDA investigators to 1,400 firms in 19 states. They were there to see that none of thousands of contaminated chickens and turkeys ever reached the marketplace. How well FDA does its job is tested in that marketplace. Americans can shop with a high degree of confidence because our country's foods, drugs, medical devices, biologics, animal drugs and feeds, and radiological products are the safest in the world. But conditions change. New challenges arise. More than 3/4 of a century ago, when the first Food and Drug Law was put into effect, the main public health concern was about the harmful substances that were deliberately packed into foods and medicines. Today, the concern is more likely for substances that end up into products by chance, that have to be detected in parts per billion, that remain in the body for years, waiting to upset cellular mechanisms and cause cancer.
Well, we've literally had a revolution in this country in the past 75 years in our ability to promote health care through better nutrition and better care. And in my judgment, there's every reason to believe that the future holds even more dramatic gains over in every field over which FDA has responsibility. I think there are going to be enormous challenges in everything we do. The challenge to make sure that the benefits of technology, which is going to be advancing all the time, outweighs the risks. The challenge to nurture innovation without jeopardizing the public health. And most important, the challenge to give the people of this country confidence in the products that they use and in the ability of the FDA to make sure those products are reliable. The work has been difficult in the past. It's going to be even more difficult in the years ahead. But that's what makes our work so vital, so challenging, and to me, very, very exciting.
The Food and Drug Administration, 3/4 of a century old, but still full of youth. This has been the FDA Story.